Mhm. Good afternoon, dear students. If you are hearing me, please uh, tell me this in the chat. Good afternoon, dear students. Please, we'll connect with lecture. Dear students, please, I wait you. Connect. Good morning. Very good afternoon. Dear students, if you can hearing me, did you hearing me, dear students? If yes, we write down in the chat yes. Good afternoon. Good afternoon, dear students. Connect, please. Should be more students, please connect all. Don't shine. I wait you. Very good. Good afternoon. Okay. Okay. Connect, and please be in the contact internet translation until the finish of lecture, please. Why? Because I can see who is present, who is absent now in the net. Now, please be actively until finish lecture, because students who will come out from lecture chat will have miss class, miss lecture. Okay, please be actively during all lecture until finish lecture, when I will set goodbye. Please так. No, okay. I'm glad to see you, many students, but should be more. Connect, please. The topic today lectures is physical rehabilitation in the therapy and in neurology. Medical rehabilitation in the therapy and neurology. Now, first of all, I want to explain you how provide cardiac rehabilitation. Cardiac rehabilitation is very actually topic for all. Why? Because the disease of cardiovascular system takes first place in the world as the reasons of mortality and the reasons of invalidization of patients. And correct treatment, correct medical rehabilitation, help correct prevention cardiovascular disease can decrease this problem. What is core components of cardiac rehabilitation? And first of all, it's patient assessment, nutrition counseling, lipid management, hypertension management, smoking cessation, diabetes management, psychosocial management, general education, maths, procedures, condition, physical activity counseling, and exercise training. And you know about main reasons of cardiovascular disease. It's hypertension, it's dyslipidemia can be reason smoking, diabetes, over stress, psychological stress, and other reasons. The exercise have cardioprotective effects, antisclerotic. Why? Because exercise can't, it's first of all, aerobic exercise can decrease the level of lipoproteins, low and very low density and triglycerides, which can be the reasons of atherosclerotic changes in the vessels and reasons many diseases. Start ischemia, disease of heart, hypertension, other. Psychological effect. Exercise have anti-stress effect. Did you remember on the first lecture I explained to you that why during physical training appear destroy of stress hormones, glucocorticoids, catecholamines. These hormones is very important, have a very important role in the manifestation many heart disease, cardiovascular disease. Antithrombotic effect in result of physical activity, exercise, produce some biologically active substances, antithrombin 3, heparin, increase velocity of blood circulation. In result, it's decrease level of fibrinogen and decrease blood viscosity. In result, decrease platelet adhesiveness, decrease risk thromb formation. Anti-ischemia effect. Exercise can improve blood circulations, lymph circulation in the myocardium, improve oxygen demand, improve coronary flow, decrease endothelial dysfunction. When person do exercise systematically long time, grow new capillaries. In result, these improve collateral blood circulation. In result of physical training, produce substances which decrease tonus of blood vessels. In result, it's nitric oxide. Did you remember? Nitroglyceride stimulate what is effect, physiological effect, treatment effect of nitroglyceride. It's increased production of nitric oxide. Physical exercise also increase concentration of nitric oxide. Its result, these have vasodilation effect, improve coronary flow, improve blood circulation in myocardium, decrease blood pressure, produce many substances which decrease vessel tone. Also antiarrhythmical effect. Why? Because systematic physical training stimulate vagal tone and decrease adrenergic activity. Also, in result of physical exercise, increase insulin sensitivity, decrease concentration of adipose tissue. It's also risk factor of heart disease. And if we now set up about rehabilitation, it's decreased risk. It's secondary prophylactic, decreased risk, acceleration of disease. Also, anti-inflammatory effect, decrease inflammation during physical training produce some interleukin, which decrease inflammatory process and decrease concentration factor necrosis of tumor. No, a traditional classification of program cardio rehabilitation. First phase, it's inpatient. Second phase, it's up to 12 weeks on the supervised exercise and or education following discharge. Phase 3, variable length program, intermittent or no ECG monitoring. Phase 4, no ECG monitoring and limited supervision. Notes on the total dose and volume of cardiac patients. For stable cardiac patient progress to expenditure of 1000 kilocalories week over 3 to 6 months. High level then this is associated with atherosclerotic regression. It's 1500 to 2200 kilocalories per week. It's 15 to 20 miles per week. Typical cardiac program is more than 300 kilocalories per session and more than 200 on non-programmed days. 19 to 43% of patients in a rehabilitation program reach these levels. Traditional exercise falls short of this goal. How about exercise consideration for the angina pectoris? Goal: increase angina and ischemia threshold. Prolong warm up and cool down, gradual rise. Target is hypertension below ischemia level, plus minus 10 millimeters of mercury. Caution with exertion of the cold. Upper body exercise may precipitate symptoms due to higher pressure response. Monitor blood pressure before and after exercise. Alternative exercise, frequent short intermittent session. Exercise consideration for the pacemakers ACD patients. Weeks with adjustable rate. Monitors systolic pressure. Extended warm up and cool down. ICD is ECG monitoring pulse to titrate intensity. Rate modulated pacemakers intensity. You can see some methods. Exercise consideration for CHF patients. Must be on stable medical therapy. Monitor hypokalemia and hemodynamic response. Malignant dysrhythmia control. THR 40 to 70%. Volume of oxygen maximum 3 to 7 days per week. 20 to 40 minutes per session. Long warm up and cool down. Interval exercise training. RPE may be used. Exercise consideration for the cardiac transplant patients. First and third year survival rates of 86% and 80%. Train RIC physically and metabolically. RIC say from data from testing graded protocols. Long warm up and cool down. Denervated heart, no angina. Low EKG sensitivity for ischemia, delay cardio-acceleratory and deceleratory response, stress, echo, and radionuclide testing. Intensity, it's 50 to 75% from oxygen volume of maximum oxygen consumption. 11 to 15 on the 6 to 20 scale, dyspnea. Therapeutic role of MPC in treating hypertension. No, before start explanation this topic, I want we will do conclusion about main principle cardiac rehabilitation. No, in first of all, cardiac rehabilitation must be always, if haven't, a contraindication. Why? Because were many investigations, scientific investigation, it's previously centered, which proved about important role physical rehabilitation for surviving cardiovascular patient and improve quality life. Note, for example, was a scientific investigation when provide comprehensive analysis mortality, quality of life, and invalidization. Invalidization patient with cardiovascular disease took 3 groups of patients. First group, after cardiac disaster, any cardiac attack, after finished treatment, haven't any medical rehabilitation. Other group, second group, took only pharmacological preparation, use long period, only drugs, use pharmacological rehabilitation. But third group have combination pharmacological rehabilitation and physical rehabilitation, the exercise therapy. And after 5 years, we'll check this group and receive very interesting results. What do you think? What results? Where was the minimum level of mortality, invalidization, and was maximum quality level of quality of life? Correct answers, dear students. The third group where provide combination pharmacological therapy with physical rehabilitation, exercise therapy. After this, many investigation which was repetition of result. After this, dear students, now physical rehabilitation combination with pharmacological rehabilitation, it's obligatory part, medical rehabilitation patient with cardiovascular disease. How about algorithm, the principle before start physical rehabilitation person with heart disease? No, if you remember in the first slide, must be patient assessment. Not patient assessment, must include, obligatory include ECG, and not only solitary ECG. Must be functional test, stress test with ECG. That provide ECG with physical exertion. That provide physical exertion on the treadmill or psychoergometer, and look at the tolerance for physical exertion. First of all, determine when appear ischemia changes or any arrhythmical changes. Or maybe increased blood pressure. What heart rate will be in this period. And after this threshold for ischemia, threshold for provocation of arrhythmia, provocation of increased blood pressure, used for calculation the level of physical exertion, intensity of physical exertion. You must understand this and will use in your practical work this knowledge. And dosage of physical exertion provide on the result of stress test, functional test. About this test we discussed in the previous lectures. Okay, how about hypertension? Hypertension, dear students, another name of hypertension is slight killer. Its disease is the reasons of mortality in the 50% all case mortality connect with hypertension disease. What 100 people died, 50% died in result of complication hypertension disease. It's very, very dangerous disease, but this disease needs seriously treatment and seriously medical rehabilitation patients with this disease. The exercise therapy is very, very important in the prophylactic. I said about this, but also first prophylactic, that's level of prophylactic, and secondary prophylactic acceleration hypertension disease also. Now, to explain the acute blood pressure response to exercise. Now, in result of physical, when start physical treatment or physical exercise in the person, blood pressure increase when physical exercise is intensive. But if physical exercise mild and moderate, blood pressure decrease level of blood pressure. What is mechanism which exercise may improve hypertension, that condition of person with hypertension disease? No, I said about this previously, but we'll repeat. First of all, in result of physical training, that mild, moderate, I will repeat, it's very important, produce some biological substances which stimulate vasodilation, which, first of all, very strong vasodilation is carbon dioxide. What else? Pyruvate, lactic acid, nitric oxide. Also produce some prostaglandins which also have vasodilation effects. Increased concentration of potassium ions in the blood. In result, this increased temperature. In result of mass miracle works in increased temperature, and you know the effect of increase of temperature on the vessels. It's also vasodilation effect. In result, this decreased blood pressure. Decreased blood pressure. Also hypertension connect with hyperlipidemia, diabetes and obesity. But if person do exercise, decrease level of lipoproteins, low density, very low density triglycerides, and provide normalization of lipids concentration, and decrease risk, decreases of increased blood pressure. Diabetes also increases, first of all, diabetes second types, increase sensitivity of tissues for insulin, receptors of tissue for insulin. It's decreased hyperinsulinemia, normalized concentration of glucose in the blood. But when combine pharmacological treatment with physical exercise, exercise therapy, in the effectiveness pharmacological therapy increase, and in result of this we can decrease dose of pharmacological preparation. It's truth for all disease that when we combine pharmacological rehabilitation with physical rehabilitation, we can decrease the level of drugs, and result this decrease risk of polypharmacia and decrease risk different side effects. It's also very, very important. Now, if you remember that about optimal blood pressure, now 120 on systolic, 80 diastolic blood pressure. Normal it's 130, 85. High normal it's 130 to 139, and diastolic 85 to 89, you know. And about stage of hypertension, first stage mild, it's 140 to 159, and diastolic 90 to 99. Second stage moderate, it's from 160 to 179, diastolic from 100 to 109. And third stage, it's more and equal 180 systolic, and more is equal 110 millimeters of mercury. So you know about pathophysiology hypertension disease, study this. I only want to say about reasons. The reasons of hypertension can be associated with salt intake, low potassium intake, physical inactivity, heavy alcohol use, and pathological psychological stress. Now, when we provide medical rehabilitation, we must provide education of patient and give advice, change, provide modification of lifestyle, fighting with hypodynamia, with psychological stress, decrease alcohol consumption, stop smoking in TASA, and control lipids and level of sugar in the blood. No, you can see that the risk factors, but all these factors which not connect with lifestyle, physical training can modify, can control the level of cholesterol, obesity, diabetes, hyperinsulinemia. Physical training, physical rehabilitation have positive effect this factor that decrease risk. You know these factors about negative effect, high blood pressure, it promotes coronary artery calcification, it's predictor of sudden death, it can be reason to brain stroke, infarction, myocardium, dissection of retina, many complications, which can be very dangerous, can be reasons of death of person. You can see how reductions of blood pressure can decrease risk different dangerous disease. No. Medical physical rehabilitation as usually must combine with modifications of lifestyles, lifestyle changes for hypertensions. You can see reduce excess body weight, reduce dietary sodium, maintain adequate dietary intake of potassium, calcium, magnesium, limit daily alcohol consumptions, exercise moderately each day, engage in meditation, relaxation daily, cessation of smoking. But dear students, what very often, if a person have first stage of hypertension disease, it's enough for normalized blood pressure. But if a person not normalized blood pressure, should be medical therapy, and implication for exercise training. In this situation, person must take drugs, antihypertension drugs. Should be pharmacological and non-pharmacological treatment. It can reduce morbidity. Some antihypertensive agents have side effects and some worsen our risk factors. Exercise and diet improve multiply risk factors with virtually no side effects. It's advantages of exercise therapy. Exercise may reduce exercise may reduce or eliminate the need for antihypertensive medication. No, lifestyle activity instructor exercise you can see the moderate intensity lifestyle activity showed similar of better results versus structured exercise for improved cardiovascular fitness, reduce body fat, decrease total cholesterol, reduce of blood pressure, patient complaints. In the past 5 years, this Surgeon General published positive statements on the potential health benefits of lifestyle activity. Now you can see the specific card for patients with hypertension, which we should recommend for improve condition of the person. First of all, it's the physical activity, the lifestyle activity. Now, how about type of exercise we should recommend, that must recommend for person with hypertension? First of all, how about gymnastic exercise? Which types of exercise should recommend? It's exercise, gymnastic exercise, isotonic exercise, isometric exercise for person with hypertension, contraindicate. Also contraindicate for person with hypertension exercise connect with bending, connect with large amplitude body movements. The contraindicate exercise connect with change position of body when low part of the body, low extremities become over the head of person. Understand why that many students from India, for example, from other countries like Hatha Yoga, when I ask them during class how about exercise therapy, they answered me must do yoga, Hatha Yoga, asana. But dear students, for person with hypertension disease, asanas with change position of body, that bending variants when person stay on the head, can be very dangerous. That was cases for practice when person with hypertension stay on the head. In result, this died. Why? Because appear brain stroke, hemorrhage brain stroke. What exercise I said, it's positive, useful, but it's not correct. Exercise therapy can be dangerous, can be very dangerous. Okay, how about sport apply exercise? What you can see in this picture, no problem, can use dancing, can use walking, running, but what's running? Not intensive running. Contraindicated students, intensive exercise. Why? Because it stimulates production of stress hormones. Intensive training, intensive physical exertion connect with hyperproduction of stress hormones, catecholamines and glucocorticoids. If you remember, these hormones increase vessel tone. Result this increase blood pressure. This exercise contraindicate for person with hypertension. But swimming, biking, там, ride a bike, да, exercise bike, там, no problem, golf, good. Да, it's about games, да, how about games? For person who have hypertension, recommend only small active games. For example, golf, very good example. That maybe but sports game, active game for this person contraindicate that what hockey, basketball, football, volleyball for this person contraindicate. Why? Because these games it's stress, it's competition, it's emotionally as usual, and you know, competition, emotional stress stimulate production stress hormones, and stress hormones increase blood pressure and can be reasons complication during this disease. No, it's mechanism that decrease blood pressure. That decrease body weight, alterate renal function to increase elimination of sodium, leading to reduced fluid volume. That when person during physical exercise have perspiration, sweating, that increase elimination of sodium and reduce fluid volume. It's very good for normalization blood pressure. Lower cardiac output and peripheral vascular resistance at rest and submaximal exercise. That you can see that it's decreased sympathetic and increase parasympathetic tone. That's systematic physical training. If you remember, I said you done previously lecture, stimulate functioning of parasympathetic nervous system. And you know what is the effect parasympathetic nervous system on the vessels? It's vasodilation. How about heart? It's negative inotropic effect and effect which decrease intensity of heart contraction, and result this it's help normalized blood pressure. Now you can see exercise prescription for patient with borderline to moderate hypertension. What should do? Look at for lipid disorders, retinopathy, neuropathy, renal insufficiency, left ventricular dysfunction, silent myocardial ischemia, osteoarthritis, osteoporosis. It must be exercise testings. For determination asymptomatic ischemia, its functions stress test must be, we discussed. Radionuclide investigation also. What's exercise recommend for person with? No, it's aerobic long packed activities, walking, biking, swimming, tai chi, step or treadmill walking also can use. No, you can see modification now on treadmill protocol. What's duration and speed of physical exertion must be. How about frequency training? 5 days per week as minimum, better every day. Start at 50 to 60% maximum heart rate slowly increased to 70%. Within 6 weeks, work at 85 heart rate, maximum heart rate, or from 50 to 90% for maximum heart rate. Duration start with 20 to 30 minutes per day of continuous activity for first 3 weeks, then 30 to 45 minutes a day for next 4-6 weeks, and 60 minutes days as maintained. Excessive rise to blood pressure should be avoided during exercise. You can see the blood pressure. It's contraindication for exercise therapy. About contraindication, if person with cardiac disease have high blood pressure, what is high? Limitation, it's 220, 230, it's a systolic blood pressure, and 110 diastolic blood pressure. In this situation, exercise therapy contraindicate. Also, contraindication is tachyarrhythmia, palpitation, dizziness in person, severe pain in the area of heart, non-distant ischemia on the during ECG, blockade, AV blockade, second and third stage. The restriction of participation, vigorous exercise should be placed on patient with left ventricular hypertrophy, you can see. Weight training, dear students, for patients with blood pressure, weightlifting as usually contraindicate. Weightlifting contraindicate. But until 1-2 kilograms, not dumbbells, for example, can use that. No, should avoid many resistive exercise, but better that should be less than aerobic exercise, resistive exercise. Drug therapy, you started that on the therapy, but I want to set about combination beta blocker therapy and exercise. Exercise therapy is desirable during beta blocker therapy to offset the adverse alternations in lipoprotein metabolism contributed by some beta blockers medication. Exercise intensity for patients with beta blocker medication should be in accordance with traditional wideness based on the results of individualized exercise testing performed on the medication. Did you remember? Individualization of exercise, it's using of those physical exertion after stress test, functional test. Summary, that physical activity has a therapeutic role in the treatment of hypertension. Non-consistent relationship between reduced weight and lower blood pressure. Exercise at lower intensity is effective in the treating mild or moderate hypertension. Exercise testing may be help identify exaggerate blood pressure response to the exercise. Okay, dear students, now the exercise prescription for NTN should be based on the medical and risk factor status. Exercise prescription should be adapted to the antihypertensive medication that maybe affect exercise, blood pressure, heart rate, and performance. Incorporation resistive training into the exercise prescription may be of value of controlling blood pressure. But dear students, some words I want to say, some words about hypertonic disease. The principle of exercise therapy for person with hypertonic disease, no, I will say what is, that when blood pressure less than normal, when we said about optimal blood pressure, it's 120 systolic, 80 diastolic blood pressure. And but person with low blood pressure, hypotonia, have blood pressure less than 110 on the 70. And less. For some people, it's normal disease. It's first of all young lady, asthenic constitution, but for many person, its blood pressure is lower than normal. I have many complication symptoms that with person. It's headache, dizziness, weakness, and other. How we can what is principle for physical rehabilitation patient with hypertonic disease? Dear students, this principle opposite than for treatment person with hypertension disease. And first of all, we will take exercise, therapy. How about gymnastic exercise? I said for person for hypertension, contraindicate bending, exercise with change position of body, exercise with high amplitude, and contraindicate exercise for resistance exercise, isometric exercise. But dear students, for person with hypertonic disease, recommend exercise with bending, exercise when head ending of body lower than low extremity ending of body. Recommend exercise with bending, exercise with resistance, exercise with weightlifting, jumping. Jumping is contraindicated for person with hypertension, but person with hypertension, jumping recommend. And also recommend vigorous physical training. If person have good tolerance for physical exertion, recommend intensive physical training. It stimulates production of stress hormones. In result, this increase blood pressure. For this person, recommend sports games. Sport game for them, person with hypertonia, is very, very good. Was one case from my medical practice. I was neurologist, worked in the students' polyclinic, and came to me a lady with hypotonia. It was autonomic disorders, but I will recommend for this lady medical group for physical training. Did you remember? What group I must recommend for this lady? What do you think? No, who answered? Special group, nah? What is special group? Special group, it's group where contraindicate sport competition, contraindicate intensive physical training, but no, I start write down in the medical certificate special group. Lady cry, no, please don't write down about special group. For me was surprise. Very often students don't want have intensive physical training, and for them a special medical group is good for physical training. But she explained me, sir, I'm a member of a team on the basketball. University team on the basketball, no, was university. But if you will write down to me special group, I cannot have training in the this team. But when I have training, basketball training, I feel good. My all complaints disappear. Headache, weakness, and other. I have very good mood, and vigorous, and very active become after training. No, in this situation was exclusion from rules. I recommend for this lady basic medical group. Where why? Because lady have only this problem, haven't other problem with health, and have good tolerance for physical exertion. And yeah, I recommended this group, and lady was satisfactory and glad. What for person with hypotonia, very good physical training, intensive and sports games. It's treatment, good effective treatment for this category of people. Okay, that's all about physical rotation patient with hypotension, and now I will try will explain you about
Красивые и свободные движения человеческого тела. Все их многообразие, гибкость и упругость – это главным образом работа межпозвонковых дисков. Каждый из них представляет собой плотное фиброзное кольцо с желеобразным студенистым ядром. Диски не только дают возможность позвонкам двигаться относительно друг друга, но и работают как гидравлический амортизатор, смягчая действие осевых нагрузок. Природа снабдила наш позвоночник идеальными устройствами. Но как часто в повседневной жизни мы, не задумываясь, искусственно создаем для них чрезмерные нагрузки. Слишком много и порой неправильно сидим или стоим. От этого все статические нагрузки принимают на себя межпозвонковые диски. При падениях, неудачных прыжках давление на диски возрастает до критических величин. В 85 случаях из 100 их преждевременный износ происходит на фоне травмирующих факторов. Начинается дегенерация диска. изменяется его химический состав и структура. Студенистое ядро фрагментируется. Образуются внутрителовые и заднебоковые грыжи. Грыжи часто травмируют нервное образование. В дальнейшем склерозируются замыкательные пластины тел позвонков, появляются костные разрастания в виде шипов, остеофитов. Высота диска снижается, возникает избыточная подвижность позвонков в передне-заднем направлении. Развивается подвывих в межпозвонковых суставах и вторичный спондилоартроз. Дегенерация межпозвонковых дисков с последующим вовлечением тел позвонков и связочного аппарата называется остеохондрозом. Он может проявиться в любом отделе позвоночника.
Меня беспокоит боль в шее, хруст при повороте головы. В последнее время беспокоит боль в плече, под лопаткой, болит рука. Имеет пальцы ночью. Болит в области сердца и головокружение.
Вы знаете, доктор, у меня очень болит позвоночник, особенно вот между лопатками, как будто ком бит. В область сердца отдает боль и под ребра.
Меня беспокоит боль в пояснице, особенно при наклоне, отдает ягодицу и ногу.
До тех пор, пока патологические изменения затрагивают только фиброзное кольцо, человека беспокоят локальные боли, дискалгия. При интенсивных и продолжительных болях происходит сглаживание физиологических изгибов позвоночника. Мышцы спины напряжены, симптом вожжей. При пальпации выявляется болезненность над остистыми отростками и в паравертебральной области. Грыжа диска или остеофит могут нарушить кровоток в позвоночной артерии и вызвать вертебробазилярный синдром, головокружение, неустойчивость при ходьбе и в позе Ромберга. Радикулярный синдром возникает при сдавлении нервных корешков. Снижение или отсутствие рефлекса с двуглавой мышцы плеча, боли в области надплечья и в руке по наружной поверхности до первого-второго пальцев, гипестезии в этой зоне свидетельствуют о сдавлении корешка С6. Если грыжа диска повреждает корешок L5, возникает симптом натяжения. Снижается или отсутствует рефлекс сахилового сухожилия. Корешковый синдром может привести к появлению онтологической позы, в частности, нейрогенного сколиоза. Для уточнения диагноза проводится передне-задняя и боковая рентгенография соответствующего отдела позвоночника. Начальным косвенным рентгенологическим признаком остеохондроза является выпрямление физиологической кривизны позвоночника. В более позднем периоде определяется уменьшение высоты межпозвонкового промежутка, псевдоспондилолистез, склероз замыкательных пластин тел позвонков, внутрителовые грыжи Шморля и остеофиты, расположенные параллельно замыкательным пластинам. При корешковом синдроме может наблюдаться сколиотическая деформация позвоночника. Сопровождается избыточным смещением позвонков в передне-заднем направлении.
захватываю микрофон.
С введением контрастного вещества
Dear students, please tell me, did you see
на
film?
всем протяжении позвоночного канала.
Students, please write down in the chat, can you see film?
Миодил переводит из поясничного отдела в грудной, а затем в шейный. При наличии задней грыжи или остеофитов размером более 3 мм, передний контур контрастного столба оттесняется сзади.
Oh, yes, no, okay. Can you see... ну, если меня услышали, значит, ты слышишь меня хорошо. Спасибо.
Более полное представление межпозвонкового диска дает дискография.
Okay, dear students, this is show the treatment of degenerative changes in the spine, the reasons of back pain, dorsalgia. Now you can see the variant of pharmacological rehabilitation with using of injections in the spine, special treatment solutions. This can use for diagnostic and provide contrast solution you can see, and also can use for treatment for rehabilitation.
В остром периоде болезни назначается строгий постельный режим. Больного укладывают на кровать со щитом в положении, в котором уменьшается боль.
This is use pulse therapy. In this position, there are minimal back pain. When it's flat. Here you can see use injection of anesthetics, anti-inflammatory drugs in the place where there are intravertebral disc hernia, degenerative changes in the spine. It's provide epidural blockade. It's also a variant of pharmacological rehabilitation patients with back pain with radiculopathy. This is use physiotherapy variant. Use electricity treatment, ultrasound treatment. This is electromagnetic wave treatment. It's provide tractions of spine. Did you remember when we discussed about mechanotherapy? It's provide traction of spine for person with neck osteochondrosis, neck pain, cervical here, and it's use orthopedic rehabilitation. Use this is collar of Schanz. This is use tractions of lumbar part of spine. It's variant of physical rehabilitation. You can see in the picture it's decrease intravertebral hernia disc, intervertebral disc hernia. It have good effect and fixate a special belt. It's variant of underwater tractions of spine. Here combine two effects, treatment effect of traction of spine and water. Also very important in the rehabilitation is exercise therapy. The main task of exercise is formate muscle, increase muscle strength, muscle tone, which will support spine in the correct position and prevent intervertebral disc herniations, the irritation of
Занятия лечебным
radiculus
необходимо продолжать и
vessels,
и стационара.
nerves.
Консервативная терапия остеохондроза оказалась безрезультатной, показано оперативное лечение.
Now you can see surgical therapy of and rehabilitation, surgical rehabilitation patients with degenerative changes in the spine. That if conservative treatment and rehabilitation was not effective, provide surgical treatment, surgical rehabilitation patients. That
Отростки и части дужек удаляются.
it's removing of intervertebral disc hernia.
Обнажается дуральный мешок. Этим заканчивается ламинэктомия.
Its laminectomy was
И максимально возможное вычерпывание диска.
and remove of intervertebral disc hernia.
Пальпацией через дуральный мешок определяется грыжевое выпячивание. Грыжа иссякается.
It's hernia now. Will be dissection of hernia. Fixate and provide dissection.
Измененное студенистое ядро вычерпывается острой ложкой. Операция может заканчиваться задней костно-пластической стерилизацией позвоночника.
And after this, provide stabilization of spine. Use special construction.
В других случаях применяют дискоктомию передним доступом и межтеловой спондилодез. Операция
It's
может
another
быть
variant
методу
of
Юмашева
treatment
Доступ
when
к
provide
диску чаще внебрюшинный. На первом этапе производится максимально возможное удаление диска. N-образно рассекают, отсепаровывают переднюю продольную связку и внешние слои фиброзного кольца.
provide dissection of ligament anterior.
Доступные участки межпозвонкового диска удаляют острой ложкой.
Intervertebral hernia use special spoon, the surgical spoon for
Вначале нож с
removing
ограничителем, затем стакан фрезы. Круговыми движениями выкраиваются два полукружных костных лоскута. Поворотом ножа лоскуты отсекаются от тел смежных позвонков. Расширенная костная рана дает возможность полностью удалить остатки диска, грыжу и остеофиты.
after this that provides removing of hernia of disc and compression of radiculus and
Складываются с поворотом на
vessels
90 градусов и
disappear.
прижимаются к ложу костной распоркой. Удаляются остатки грыжи и остеофиты. Полукружными лоскутами перекрывается щель между телами позвонков. Вводится распорка. Аутотрансплантат, плотно прижатый к ложу по всему периметру, способствует быстрому образованию костного блока. После операции важно избежать осложнений со стороны внутренних органов и создать благоприятные условия для формирования костного блока. Большое значение придается лечебной физкультуре.
After this use, also
Сосудистую и дыхательную системы,
exercise you can see after operation, that is breathing exercise for muscles, upper extremities, lower extremities, necks, breathing exercise, that it's prevention complication after surgical therapy.
формируется костный блок, больной ходит и занимается гимнастикой в корсете.
After some days, start exercise in the special orthosis, that provide exercise, that train muscles, that, and
лечении дополняются специальными упражнениями в воде и плаванием.
and use special exercise in the water, hydrokinesiotherapy.
Остеохондрозом.
For this patient, exercise water very effective. Why? Because in the water, the exertion, extra exertion on the spine decrease, and have very good training.
Все же главное – это профилактика. Нужно с
Ну,
детства вырабатывать
understandable.
правильную осанку, учиться грамотно поднимать тяжести, избегать лишних движений,
Physical rehabilitation is good, but better prophylactic
мышечные контакты,
back pain.
предохранит межпозвонковые диски от неблагоприятных
What should do? It's correct weightlifting, avoid hypokinesia, avoid trauma of spine, provide correct training, sports training, and that. Okay.
You or someone you know may have an ongoing pulmonary or lung disease. This video will show you how a pulmonary rehabilitation program can help you live better with lung disease. Before you start your program, your healthcare team will learn about your health history. For example, you may have had problems with your heart or blood vessels. Then they will test how well your lungs are working. Breathing tests will measure how well you can breathe in and out, or how much air your lungs can hold. A 6-minute walk test may be performed. Your heartbeat, blood pressure, and blood oxygen level may be monitored. Your healthcare team will use your health history and test results to custom design your program. Your program may include 3 main parts: exercise, education, and counseling. Over time, exercise can make your lungs and heart work better. It may also increase the amount of time you can perform your daily activities, such as work, shopping, and exercise. If appropriate for you, your program will include aerobic exercise. This type of exercise makes you breathe harder and your heart beat faster. In addition, strength training exercises can make your muscles stronger, and stretching exercises can improve your flexibility. Education could include classes that will help you understand, manage, and cope with your lung disease. These classes will explain how the lungs normally work. They will also explain how diseases, such as chronic obstructive pulmonary disease or COPD, affect your lungs. You can learn 2 ways to manage your breathing. In pursed lip breathing, you slowly inhale through your nose and exhale through your mouth with pursed lips. In belly breathing, you train the diaphragm muscle to do most of the work of breathing. Your healthcare team will talk to you about your medication and lifestyle changes. You will be shown how to use oxygen if you are receiving this therapy. Talk to your doctor if you have questions about your medication or have any side effects. It is important to take your medications as directed by your doctor. If you smoke, lifestyle changes will include a plan to help you quit. A diet expert will help you make an eating plan if you need to gain or lose weight. You will also learn ways to help prevent respiratory infections like certain types of pneumonia and the flu by getting vaccinated. The healthcare team may work with you to make a plan to help save your energy. This can help you get more done while avoiding too much activity. Your program may also include counseling. This will help you cope with worry or depression you may have about your lung health. After a few months on the program, you may be given additional exercises and lung tests. These tests will help your healthcare team know if you're reaching the program goals. These goals may include increased tolerance for daily activity, less disease symptoms, and self-management and coping skills.